Hello and welcome to this first theatre-specific update video during the COVID-19 pandemic. We thought we'd try a new way of bringing you updates and learning from our teams because it can be difficult keeping up with emails and word of mouth. I'm Andy Hughes, consultant anaesthetist at Glenfield, and if any of you would wish to be part of these updates, then please do get in touch. First point to mention are the feedback posters which have been placed around theatres. We received just one comment through this method, which I'll address later on. Of course, you can still let your team leaders and matrons know directly about issues. This was set up just to assist that process. The matrons receive the feedback provided this way. Your observations and suggestions during this time will help refine our collective practice. So, the comment we had pointed out that the training received was mainly around managing COVID-positive ITU patients or retrieving them, but not much on how to manage normal emergency operating lists, donning, doffing in clean theatres, etc. So, a couple of things I want to mention here. Firstly, a good thing to read is the government website, gov.uk. Under this specific guide shown here, there is a section for operating theatres shown in the red box. And if you click on that, it takes you to section 8. Here it discusses patient movements, precautions, aerosol generating procedures, and the impact of airflow and cleaning. So that's the first thing. The next is a set of theatre action cards. These theatre action cards have been adapted by staff at the LRI for local use. I'll show all of them here for 2 seconds each. There's 13 of them. You can pause this video to take a look. If you are going to do that, do make sure that you're viewing in HD, otherwise the resolution won't be good enough to read the text. Now, whilst all the answers you may need might not be here on these cards, hopefully the additional stuff I'll cover over the course of this video will make things clearer. Some of the stuff that we're going to cover came out of a session we ran with theatre staff based on these cards. Aerosol generating procedures, lots of chat about these, and there is a definitive list which is shown here. The relevant ones for theatre I've highlighted here, so as you would imagine, airway type manoeuvres, tracheostomies, bronchoscopies, and also the use of high-speed devices during surgery. Just note here that manual saws or jigglies are not considered high-speed devices. At this point, I also want to bring up the topic of CPR because there's been quite a bit of confusion nationally in the past week or so. Bottom line is, chest compressions and defibrillation are not considered aerosol generating procedures, which is contrary to earlier Resus Council UK statements. So in an arrest, chest compressions can be started with level 2 PPE, that is a normal surgical mask, eye protection, gloves and an apron. And I know that may come as a surprise to many of you, but that is the official line. That said, however, as you recall from the list of AGPs earlier, airway manoeuvres are aerosol generating procedures, so level 3 PPE will be required because you're going to be supporting the airway side of things. So this is your FFP3 mask, visor or equivalent with your gown and gloves. Note that it may well be that actually the airway has already been secured if there is an arrest in theatre. Other important differences to the ALS algorithm are shown here. Again, please pause and take a read through, ensuring you're viewing in HD mode. Or, of course, you could just visit the Resus Council UK website. PPE. Summary of PPE shown here. There was an update from Public Health England recently, but actually our own UHL guidelines were already in line with that. So this update really didn't change anything for us. Basically just follow our guidance that's shown here. A lot of concern about the stock and supply of PPE. I think that's a national concern. We do now have a REDS team member on each site and a daily stock form is completed. Like I say, it's a national problem, but UHL does continue to receive deliveries and also donations, as is evidenced by the range of kits we now have. Which brings us on to the FFP3 masks. Due to the variety of number of masks we're getting, it's become nearly impossible to logistically fit test everyone on every device. So self-fit testing guidance has been now issued, and you should be able to find this in your clinical areas. So if you find yourself using a mask that you weren't tested on, this is the way you go about doing it. There is no fit testing being planned at the moment. And I've just done this as close-up in case you haven't seen this document, so you can pause this and take a read through. This is the fit check. Donning and doffing. Now, there will be 2 members of staff during the day and 1 at night, situated in the donning and doffing area by Theatre 1, and this is to assist with the PPE, particularly the buddy checks, and also the removal of the respirator. There's been some discussion of shoes as a source of transmission. Whilst the use of shoe covers seems very obvious, they do unfortunately have quite a big impact on the grip, so slippage becomes a real problem. So we're asking you really just to wipe down your shoes, theatre shoes, with a Clinell wipe in the doffing area when exiting these hot zones. Fogging. Respirators are only going to be fogged once a week now. The hydrogen peroxide is damaging the rubber of the mask, so just wipe them down during the week, and then once a week they will be fogged. Scrubbing for COVID positive patients. At the moment, just for patients going to Theatre 9, which is the hot theatre. People have been asking for a bit of clarity. For the hot theatre, Theatre 9, don the level 3 face mask, so that's your FFP3 mask or equivalent, in the donning area. This is the perfusion room that's next to Theatre 1, which is our donning area for that corridor. This is to allow you to get down to Theatre 9 safely. Keep the mask on when you get there and scrub as normal, but you put double gloves on. Open the sets, check them, and then wait for the patient and the team to arrive, as they will be bringing the patient directly from the ward into theatre. When it comes to doffing, remove the top set of gloves and the gown if that has been soiled, alcohol the undergloves, and walk down to Theatre 1 doffing area to take the rest of the kit off. There is some national guidance shown here, which you can pause and take a look at, and some information about decontaminating reusable, non-invasive patient care equipment. So for example, if we're going to decontaminate Theatre 1 anaesthetic room or the hot theatre, you would keep your PPE on and do the first wipe down with a detergent wipe, so this is the Clinell wipes. You then doff your PPE and you wait for that wipe down to dry. You can then put on a normal surgical face mask, apron and gloves, and wipe down with Claw Clean. So you don't actually need to fog the theatre. Double bagging specimens. Again, just for the hot theatre, Theatre 9 at the moment. The first bag is done in theatre and hand it to the runner outside, and then they will then put that in the second bag when they reach the end of the hot corridor. And this is all really to protect the staff in the labs when receiving those samples. Finally, the wellbeing areas. A number of areas now exist for your use. You should have all received an email in the last few days detailing these spaces and also the support available. Pictured here is the retreat, but there are several other areas too. There's a lot of goodwill coming into UHL, and it's a tough working environment out there. So use what you need, leave the spaces as you'd like to find them, and do take a look at some of the wellbeing resources available. And that's it. Thank you for joining me. Keep your comments and suggestions coming through the QR code or via your team leaders and matrons, and I'll see you next time.